Welcome to the Art of Timeless Skin, the virtual event over Softwave and Vivace. I'm Mindy Bullock. I am a laser tech esthetician at DTRN here in Houston, Texas. Please stay for the whole event. That way you could ask any questions that you may have because I'll be answering them live. And you can enter to win these awesome prizes, which could be Softwave Full Face, this bad boy, Vivace Full Face, or what I like to call Witchcraft in a Bottle, the TNS Advanced Plus by Skin Medica. All right, Softwave. What is this crazy treatment we're talking about? What it does, it's for lifting. It helps to rebuild your collagen, your elastin, hyaluronic acid, and to volumize the tissue. It is using these ultrasound waves that they made into these little columns that they deposit into your mid dermis. And because of that, you're able to get this awesome revitalization of your tissue without any downtime. So that's what's like really unique to this treatment, with it being able to lift the skin with no downtime. You know, we're able to treat, I mean, you got loose skin, I'm treating it. I don't care where it's at. Let's go for it. But what you can see is like your brows lifting. You can see your jowls lift. Guess what? This and this, it's going to help with that too. Areas that can be treated with Softwave is you can do your brows, like we all get that little bit of hooding, and then you can do your under eyes, and they're fantastic for that crepey skin underneath the eyes. Jowls, these guys, no one likes them. We all get them. It can do that. Submentum, this all under here, and then through your neck. Guess what? No one likes their arms anymore. When we see people as we age, everything gets thinner, and it's just so hard to treat this. Softwave is indicated for that. Even with our, weight loss journey that we're going through, we see a lot of extra little crepey skin, and we're like, no, wasn't a problem. It's the problem. You can even treat the tops of your knees right through here. And we've even done some abdomens and gotten some pretty nice results as well. We have Vivace Ultra to talk about too. Oh my gosh, so many fun things. What's the difference? So Vivace is radio frequency microneedling. Yes, I understand there has been some bad things out there about it, but with this guy, there's ultrasound. This ultrasound, we utilize it to actually just image a true ultrasound picture. That way we know exactly where we need to place that energy without getting rid of important things, like if you want your fat in your face, it'll keep that. So what it's going to do, it's going to help to tighten the skin. It helps with tone and texture, and we just see really cool results. And it can also, if you really wanted to get a little crazy with it, compare with the Softwave. So Vivace, what it can treat, I mean, it treats your skin. Where you got skin, I'm gonna treat it. So we can see most common though is face, full face, and neck. It can help with also acne scars, as can Softwave. These are just really great treatments. And this one, why would you do this over Softwaves? This one can have a little bit of downtime. All right, it's like this new buzzword, it's all over the place, and I'm frankly here for it. Stackable treatments. Like, why are we gonna stack them? Well, it's because we're trying to get you to your end result the quickest way possible. And we wanna cover a bunch of different areas. So when you do Softwave, it's for tightening of the skin, it's gonna lift it, but it doesn't do so much for your tone or your pores and some of the minor texture that the Vivace can treat. So whenever we combine the treatments, We're treating at your mid dermis with the soft wave to give you a lift. Whenever you do the Vivace, we're doing it to do a little more superficial, help with texture, minor texture, pores, pigmentation to give you the tightening. Thank you for taking time out of your evening to learn more about SoftWave and Vivace. Stick around for the next 15 to 20 minutes because we're going to have a live Q&A. If you're one of the lucky winners, we're going to be reaching out to you via email, text message, or phone call, or maybe all three. Also, if you are interested in a consultation to figure out which one of these treatments is best suited for you, check your text messages. There will be a link there. Hello, everyone. Okay, there's so many awesome questions coming through, so bear with me. I am waiting for my fancy bifocals to come in because I can't read small print anymore. So bear with me, guys. All right. So some of the things that people want to know about downtime. Downtime can vary. When we talk about Vivace Ultra, um, downtime can be all over the place. It's the only thing that I dislike about this treatment is because I don't know what your downtime is going to look like. So we're just going to prepare you for the worst. If that doesn't all happen, then yay! But you can have some minor swelling, some redness, mild pinkness. We get what we call little crusties. They're little micro scabs that can be all over. They can take about a week to come off. We've also seen the skin purge get some breakouts as well. And a combo of those might happen. They might happen differently every time. I'm not sure. With the Vivace, the typical treatment plan is 3 treatments. You may need more, but that downtime can vary each time. We do have things in office to help, and then also having a really good post care plan and take home with you can help to alleviate some of that. So we have things to help you, and we are here for y'all the entire time with that. And then with the soft wave, no downtime, maybe a mild pinkness, but that's it. And then, so for active acne too, we can, it's not really indicated to go over active acne. However, as long as it's not super really cystic and painful, after we're done doing the full treatment, we can go back through and treat over the active acne, just because I don't want to spread bacteria. But the radio frequency, it does help to dry out extra oil and help to dry out that P bacteria and stuff. So with melasma, switching gears now, melasma. Everybody is worried about melasma because I mean, hey, it is, no one wants melasma worse. Both of these treatments, we're depositing heat into the tissue below where the melanocytes are, so we're not aggravating them to make the trigger the melasma. So they're both melasma safe. And then for how many soft wave sessions do we need? So back to, okay, Vivace, starting at 3. That's pretty much the basic one. If you have more moderate to severe laxity for Vivace, you could be looking at more. Even acne scarring, the acne scarring is terrible. So we might have to do more treatments in the 3 with soft wave. That one is, again, these all vary. This is why a consultation is always so important, is because we need to go over to set that expectations, how many treatments. So depending on age and laxity, soft wave can be, one. A lot of people, it is recommended two. It's so safe to do. Both of these are so safe to do that, spaced out properly, we can continue to do treatment as long as we're seeing the results you're looking for. And then between treatments, okay, first Vivace, 4 to 6 weeks. This allows our skin to heal and the heat to get out of the heat to get out of our tissue, and then just our body to repair. So we like to see back at 4 to 6 weeks. That's also the sweet spot of when our collagen is starting to reemerge. All my stuff that I do, I'm breaking down collagen, and I need to rebuild it. And whenever we're talking about rebuilding, and this is going to play a part in the soft wave, we really want to get it when this brand new collagen. Think of collagen like little babies. They want to learn and absorb. So my new baby collagen that I just grew, it's super absorbent of heat. So we want to get it at that 4 to 6 week mark. But you have up to 90 days for your second soft wave, if you need a second one at that point. And then let's see. I use hydroquinone and tretinoin. So if you use any type of topical, and it's still making you, we typically say to be safe, anything that can make your skin irritated, quit using it 3 to 5 days. If your skin is not irritated, you don't have the dryness, the flakiness, any of that irritation, you can stay on it with treatment. Darker skin types, so we do recommend, just to be as a precaution, go ahead and get off of it 5 days prior, and then we can talk to you about when to start up your routine and what is acceptable following that treatment. And then, so how long does the appointments take? This is going to vary, right? They're typically, the numbing is what takes a while. So we usually numb you for an hour for each treatment. Depending on how many areas is how long it's going to take. So the average face for Vivace takes 45 minutes. If we're doing full face for the soft wave, it can take 2 hours. So it's just something, again, that whenever we do our consults, we go over and we tell you for each area how long to expect to be here. Oh, I like this. Let's see. How does Vivace compare to BBL? They're completely different. So BBL, your photofacial, let me explain that. Photofacial. It's nowadays I have to explain that. I'm not trying to treat your butt. I'm just treating, your skin, not giving you a new butt. But with the BBL, it looks for your superficial browns and reds. Over time, can you see some pores and minor texture improvement? Absolutely. But it's not safe for all skin types. And it isn't really good for a lot of melasma. When we do Vivace, it is a tightening treatment. So we're trying to get tightening out of it. We're trying to treat deeper, coarser wrinkles and do have a more texture. But because we're using needles to break up our collagen, we can also break up pigmentation. So you can see a great improvement with your pigmentation as well with the Vivace. But they're two totally different treatments. One is superficial, and the Vivace treats a little bit deeper. And then when do we see results? I would, sometimes I wish I could just be a magician and you could see results immediately. Actually, you kind of can with soft wave, but unfortunately, it's just a sneak peek. So soft wave, because I've put all this heat into your mid dermis, our tissue retracts. So it kind of it gives you the appearance. You get to see what it will look like. But after that heat escapes your tissue, your skin will go back, and then the rebuilding process will take time. So most people, it takes 3 to 4 months to see the true result from the one treatment. Now, can you start seeing a little bit sooner if you're someone that has younger, really healthy skin? Sometimes you can see it sooner than 3 to 4 months, but that is just the natural process. It takes that long because, again, I'm breaking it all down, Got to build it all up. It's not a whole say. Rome wasn't built in a day. I wish I could give you the awesome treat stuff in a day. Or I try. I'll try my hardest. Um, but with the soft wave, it does completely, it builds all the way to 6 months. So that's just something else really neat about it and unique to itself, that it continues to build after our first treatment all the way to 6 months. Vivace, you could maybe see some, some tonal improvement in that first month, but really we're looking at 3 months, 3 to 4 months. And then let's talk about age. So this question is, will a 66 aging mature skin woman benefit? Absolutely, but managing our expectations of what we can do. If you have skin, yes, we can get improvement. I treat people all ages, all ages. I think my oldest right now is around 83. Now, as long as there's no health concern, we can continue to treat. Would you need more love and attention to get to a desired outcome? Yes. If you're a surgical candidate, I can't replace surgery. We will always manage that expectations of what our treatments can do in that consultation again. But you can definitely see the improvement. I cannot, there's no replacing surgery. I mean, technology is getting really good, and I love that. The benefits is, surgery, you are going through the anesthesia. There's just a bunch of scary things with that. So some people do opt to just do these treatments, and that's to each their own. I know I'm a big baby, and my coworker laughs that I'd have to be in a medically induced coma to get through a facelift. So yeah, I'm soft wave Vivace all day long for a very long time. But yes, everybody can see improvement. It's just managing the expectations of how many treatments that we would think that to get to your desired outcome. And then between the Vivace treatments, again, 4 to 6 weeks, 4 weeks. You could even kind of do it a little bit sooner, 3 weeks. I typically do that with more of my lighter skin types, just because we don't want to run the risk of hyperpigmentation that can be caused with the Vivace on a darker skin type. It's a very safe treatment, so please don't get too scared with that. But we will space that out properly, and we will go over that with your treatment plan. Sorry, I keep hitting this thing. Pain. All right, let's talk about pain. This is something that everybody asks about all my treatments. I mean, I do torture people for a living. I'm sorry, guys, it does happen. But I don't want y'all to focus on that, because, back to, we have a really good numbing cream. We do numb you for a while. Um, Pain is just something we don't know what we're going to expect. So your first treatment is always going to usually be the worst, because our anxiety is like way up here. So what we can do in the room, I have a lot of toys to just distract you. We have a thing that blows really cold air that has really helps. In worst case scenario, I have the Pronox system, that's laughing gas, and that's an additional fee, but that does help to manage the anxiety and kind of relax you. But most of these treatments are very tolerable, and we treat to your comfort level. There's so many different things that we can do to make sure that we get to a clinical endpoint. So sometimes, I'm not looking to just torture you. I want your pain to be at a 4 or 5. Anything beyond that, we need to adjust. So I don't like my clients to get too focused on the pain, because we just have so much nowadays to really help you get through it. So with the radio frequency for crepey arms, um, absolutely, you can get some results. Again, crepey arms are going to be, when we talk about arms, it depends on where, like soft wave, we really just want to treat the crepiness. So really the stuff that goes through here. If you're trying to treat more tone, then we could treat more of the arm. But yes, if it's, when we deal with body, you can potentially have maybe an extra treatment here or there with it. But we have had great improvement with arms. So can we do both in one day? Uh-huh. Yes. I mean, you're going to be with us for a while, so just get ready. But why would you do the two? They're two different types of heat, and they get to different temperatures, and we target different layers of the skin with it. And so when you can do that, where the reason you do it is to try to get the best outcome you can, right? So, with the soft wave, we're not treating pores. I'm not treating pigmentation with the soft wave. So when you do the Vivace, you're doing something that can help with the pores and the pigmentation. And then you're getting more of the tightening effect. And with the soft wave, we're getting more of a lifting effect. So just give me those spanks, sister. Let's pull it all up. And then let's do the tone and texture. Let's kind of do a little bit of all of it. And then, for hypothetically thinking, talking and thinking, you may not need, as say, let's just say that we were like, you need a series of 3 Vivace, 2 soft wave. If you do the Vivace and the soft wave together, then maybe you won't need to do the 3 Vivaces. Maybe we can get away with doing a soft wave with the 1 with the Vivace, and then just do the Vivaces. So that is something, or I mean, shoot, keep doing them, whatever. As long as it's safe and we're not having any issues, we can most definitely do it as long as we're managing the expectations of what we're trying to do. Absolutely. And then the melasma, if you have melasma with soft wave, with the soft wave, Vivace help. So soft wave does nothing for your melanocytes. It does nothing for pigmentation because of the type of energy it is and where it's at in the tissue that the energy is delivered. The Vivace, not that it is FDA cleared for this, but it's a microneedling. So I'm just going to be making these channels throughout your skin. And so whenever you're doing these channels, you're breaking apart that pigment. So could you see some improvement in the melasma? Yes, it's not my like melasma go-to, but if you're like, hey, I have melasma and I want some tightening, I have some deeper wrinkles, which one should I do? Like we could do the Vivace. So we could do like, get a little bit of a more even tone. If you were someone that was really worried about the melasma and you had a severe case of the melasma and you were just worried about the heat from the Vivace, again, both of them, we put that energy in your mid dermis, so you would be okay. And especially with the Vivace Ultra Vision, we are scanning your collagen, and so we know where this collagen, your dermal epidermal junction is. This is where your fibroblasts are. This is where all the elastin is. It's like, yes, girl, put it all right there. So with that one, we can put it all right there. So we know that we're getting below where the melanocytes are. So either one of them, it just depends on which treatment, depending on what we talk about, which one we in our consultation, right? Let's see. So for can Softwave do knees and elbows? I have one of my coworkers has done a set of knees, and ooh, they are some sexy knees now. You want to wear that little mini skirt all the time. So yes, you can do knees. Elbows are tricky. I know I started looking at my elbows the other day too, and I was like, what in the world? When did this happen? Like now I'm just gonna sit here and probably play with my elbow skin because I'm thinking about it. But I haven't done elbows. It's not indicated for the soft waves in that area. But we could definitely talk about it in a virtual or in person and just kind of see what is actually going on there, and then potentially doing it. Is Vivace painful? That is another one. It's everybody, it pains relative to each person, and that we truly do treat to what your comfort level is. With this new Vivace, for those that have done the legacy Vivace, it has different things, different components that we can change, different sets of needles that we can use now, that actually help it be a more comfortable treatment. So typically, like It can be a little ouchy, but it's not usually a residual pain. Soft wave, there's no residual pain for the most part. Maybe a little tender to the touch on the jaw or anywhere bony, maybe up to 12 hours. And then just like a little bit of warmth with the Vivace. But typically there's not residual pain, and it's just more in the moment, but we can kind of get you through that. And then with injectables, like our front desk team is really good at spacing out your injectables with my treatments. The rule of thumb is I go first. I'm the most important. Me first. Just joking. It is your rule of thumb. If you come and see me first for the most part, you're good. And then if you put me a second, then we want to wait 2 weeks just to let everything settle. And then with Juvederm or any type of filler, it's actually better to treat with me first because potentially you may not need as much filler. Now for Botox, always get your Botox. I don't know. I mean, not everybody is, wanting to do Botox nowadays, and that I understand. When we do Botox with my treatments, they go very well together. They complement each other, and so the little fine lines that are left over after your Botox treatment, and let's say you're just completely frozen and you still have the little lines, that's where I come in for sure. We will space that out just accordingly whenever you book. And then can you do these procedures when you're pregnant? No, I'm so sorry. No, we can't do anything. Pregnancy, breastfeeding, even though breastfeeding, you would be a little more on the safe side for some of them, but there's lidocaine involved in this. And that's why we most definitely can't, is because of the numbing agent and because you just can't treat when you're pregnant because of they just don't want us to run any type of risk. So I am sorry. So once that little beautiful baby's here and then you're done breastfeeding, if that's what you do, we can just plan for after all that. I mean, I just had a baby I just didn't. He's almost 6 months old. But I mean, I wanted to do all the things and then I got tired after I had him and I'm like still waiting to do all the things. But we'll get there, sister. We'll get there. And are any skin condition worsened by the soft wave? We haven't seen any. So just to kind of go more in detail on how it's delivered, the handpiece has a really cold chiller plate attached to it. So it cools the epidermis, delivers the energy, and then cools after the energy has been delivered. So it traps that at that 1.5, 2 millimeters. So it's beyond the topically, so it's not where any type of condition that you have, more superficial lies. So when you put it deeper, that's actually safer. I haven't seen anything as of yet get worse. There's always going to be someone that had something, like we're not going to treat over a rash or active acne with the soft wave. So if as long as there's nothing like a true skin concern at that time of like medical concern, then it's typically pretty safe. And then how long do these treatments last? Well, a year, unfortunately. There's just the aging process that we haven't been able to just turn off yet. That my analogy is we're on this conveyor belts of life. I come in like the claw machine and I just pick you up and I put you back down, but you're still going. So we're just slowing it down. And one day, one day. And then for stretch marks, so stretch marks are, depending on what you're trying to treat with stretch marks are extremely difficult. None of these are really indicated for that. If it's where they're kind of raised and thick, ropey, like I call it, the Vivace might help to break up some of that, or if they're, darker pigmented. They could. I typically, if they have pigmentation, I go towards my BBL to pull out the red or the purple or even the hyperpigmentation from it. But I really, there's no true treatment out there to help stretch marks. I'm so sorry because I know They just are terrible. So I would have to see them in person to really even see what you would be a candidate for. So I do apologize for that. And then, so back to downtime with the Vivace, maybe a week, maybe nothing. Like that's the one again, that's the one thing I hate about it is because I don't know what that's going to look like. You can have the micro crusting that can last around a week. You can be pink to a little red and puffy. Some people do purge. You are able with both of these treatments, soft wave, you can apply your makeup, do whatever. I have no rules. Soft wave, you're gonna love me. I have no rules. I'm the fun parent. If like Vivace and some of my lasers, I'm a really strict parent. I'm sorry. I have a lot of rules. You're not gonna like me. No one wants to come over and stay at my house. I get it. But with the Vivace, you can apply makeup the next day, soft wave directly after you can apply makeup. So sometimes that does help. And we do have things in office and we have some remarkable post care to help to alleviate some of that downtime. And then just kind of, yeah, the treatment. So they last about a year. You can do minor little tweaks in between that year to keep that collagen going. And so it just depends. Like with the Vivace, it's a microneedling. So I tell people, hey, we'll do our three, and then let's kind of throw in a skin pin just to keep the collagen going for the next every like 2-3 months until maybe you're due for your other series. Soft wave. Um, just doing your one or two a year is what it's indicated for. But that doesn't mean that you can't still come in and do other treatments to address other concerns and just to give it a little boost. But a year, everything lasts a year. Sorry, guys. The one day. How fast will you see results again? It just we tell everybody just go ahead. Got to be patient. I'm a needy girlfriend, but you got to be patient with me too. So typical women, right? So it takes 3 to 4 months before we start to see, and like I like to see you every 4 to 6 weeks. Ooh, I love this question. Can you get your soft wave done with your BBL? Uh-huh. Oh yeah. So this is where I was talking about stackable treatments. It's just not just for doing Vivace and soft wave together. Let's let our minds run wild for a second. Let's just talk about soft wave. It's a little easier to do that. But when we do soft wave, just tightening your skin. So, and it takes forever, right? I just said you got to be patient. I'm gonna need a girlfriend, and you got to be patient. Blah 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 blah. But what about if I could do one of my other lasers on top of it to polish the skin and to kind of get you through to give you something. So yes, absolutely. And plus, like BBL can be a little uncomfortable. You're numb for the soft wave. We'll just do your soft wave, and then we switch over and do your BBL. So now we're targeting your browns and reds. And while the soft wave is doing the background work of tightening your skin, you can do. I mean, with soft wave, you could basically do any treatment that we offer here on top of it. Not fillers or chemical peels, but all the other skin services we can do directly after Vivace. We typically don't do photofacial after that, just because of the type of injuries that are there. But that's something that we can discuss. So Vivace, really cool things to pair with the Vivace, besides the soft wave, Moxie or the cool peel. And those will help to target more pigment and more of the pores as well. Let me see. I'm just going through, seeing if I missed anything. So, how does this compare to old therapy? Man, okay. So, we used to have old therapy. Old therapy works, but it was extremely painful. And then it also, for people that needed to really truly see some more tightening, they weren't seeing as much as they wanted to see, just because we treated at a really deep plane. There's a bunch of plastic surgeons out there and doctors out there right now that feel like you shouldn't be treating at this as. I mean, I'm not a doctor, so whatever they want to say. But we still weren't seeing as much as improvement with the tightening because it was treating so deep. And then you did treat some in the dermis. We saw a lot of tightening with our Vivace and our Halo. And so that just naturally we're like, oh, what's going on here? So this is when Softwave came around and we're like, hey, we treat in the mid dermis. So they're actually treating in the skin and they're utilizing ultrasound waves, which that is what ultherapy is ultrasound waves. But ultherapy was putting little pinpoints of heat and we're laying down columns of heat with the soft wave in the mid dermis. We're not going anywhere beyond it. We're superficial right there. It's way more tolerable treatment, typically a little bit of a quicker result, and it and just better results typically. And for like for the next, I mean, we got to throw everything at a neck sometimes, but the soft wave has been my most favorite treatment that I've done for getting someone's neck back into shape. I think we have got a lot of them. And then I know we have a couple questions based around pricing. It just depends. It ranges really on how many you need. Our membership program, our promos that we have fantastic promos and specials going on. So, definitely book a consult. That way we can, tailor the areas to you and managing expectations for you so we can give you that information. And then can you feel the heat during the process? So the heat is felt differently. So soft wave feels more like electric little current. You don't feel like a blast of heat, let's say with like the BBL photofacial, if you've ever had one of those. And then the RF microneedling, that one, oh, I don't do well with this one. It's almost like a hot tack for some people. Again, our numbing's really well. It works really well. So please don't let me scare you off. And, there's just different ways that we treat nowadays, even versus when we first had the Vivace. So don't get too caught up on that. We will get you through it. So these with the Halo versus the Halo, um, what I typically like to do. So if we're gonna do, let's say, soft wave halo, I mean, you can do them on the same day. That's a lot, but we could do it. But I always like to do my soft wave first because we let him do the tightening. It's a deeper treatment. Let them that tightening start going, and then we can go into our other series of things. So I like to just knock that one out, and then we can continue on with our treatment plan. And then soft waves with Sculptra or even the hyperdilute radius. Oh, yes. So I just had a conversation with a client about this. If doing soft wave Vivace, a lot of my treatments paired with the Sculptra or the hyperdilute radius, we're building different types of collagen. And so getting collagen at all different levels, yes, do it. Pairs very nicely. You can get them done on the same day. And so that's nice because you're already numb. So you'd see me first and just go see one of the injectors after that. All right. Well, these are fantastic questions, guys. I love doing this. I love having this education, and I love that you wanted to spend more time and take time out of your evening to join us to learn more about these treatments. So we look forward to seeing these consultations and talking more with y'all in person. So just keep your phones nearby. We're going to be having that giveaway and also sending that text out for you to book your consultations. So again, thank you so much and have a beautiful evening. Bye.